everybody. I'm Brittany Lewis, a breaking news reporter here at Forbes. Joining me now is Lynn Barr, founder of Caravan Health. Lynn, thank you so much for joining me.
Thank you so much for having me on the show.
I'm really grateful you're here. It's a really important conversation we're going to have. The government shutdown showdown we saw in October and November was all about healthcare costs in this country, specifically the enhanced Obamacare subsidies that are set to expire at the end of this year. And if they do in fact lapse, over 20 million Americans will see their premiums skyrocket. Senate Democrats and Republicans had different plans to address healthcare costs and had a vote on dueling bills. Neither plan passed, though. We will look at both proposals. But to start off the conversation, what are your thoughts on the impasse we really seem to be at as an entire country when it comes to really high healthcare costs?
Well, it's not really a partisan problem. I mean, the cost per capita in the United States is more than 2.5 times the other developed nations in this country. It is a bigger problem than this. We're trying to play whack-a-mole with, trying to help this sector and this sector and this sector, but every American is being punished by our costs that are completely out of control, that are paired with outcomes that are part of the lowest in the OECD countries.
And if you talk to anyone, they'll tell you a time probably where an unexpected health incident, either related to themselves or to a family member, almost bankrupted them. And the fear that people have when they say, I can't really afford any type of health disaster right now is staggering, especially being in the United States. I know you said that this is going to impact every place in America, but specifically, where are you going to see the impacts the most in this country?
You bring up a great point, Lindsay. I mean, the cost of healthcare is causing bankruptcy in the United States. So it's the number one cause of bankruptcy in the United States, and that goes across the board. So this isn't just any small sector. That's all across the country, and over 62% of bankruptcies are caused by healthcare costs. So how do we stop this whole train from moving forward? And if you look at the average cost per year per capita in the developed nations of being between $5,000 and $6,000 a year, and we're paying more than $15,000 a year per person, that's about $3 trillion more than the rest of the world, right? And per year, every year. And so, we play whack-a-mole and we're like, oh, let's try to help these people and try to help these people. We have to fix a bigger problem, because no matter what we try to do, and I definitely don't want people to lose their insurance, but everyone could have insurance if we just brought down the costs, and we're not actively succeeding in any of those initiatives.
And I know that there were two dueling plans to bring down healthcare costs, and I want to talk about them and get your thoughts on them. We'll start with Democrats. Democrats in the Senate wanted a 3-year extension on the premium tax credits. That sounded like a temporary fix. What do you think of that? Because that would expire in 3 years.
Well, I think that we're going to have to throw lifelines to people that need it until we solve the problem. But the problem is, this doesn't solve the problem, and there's nothing moving forward that actually solves the problem for all Americans. We can't be competitive as a country when 60% of our healthcare costs are being paid by employers, and our healthcare costs cost more than wages do in other countries. So we have to really think about, do what we can. We have to help the people we can help, but our deficit spending, right, which is $1.5 trillion per year. We could solve that problem just by getting down to the next less expensive country, right? Just to be as cheap as Switzerland, which, by the way, they live 5 years longer, than we do, and have much better outcomes. So we've got to really fix the bigger problem. But in the meantime, we've got to throw lifelines to the safety net. We've got to throw lifelines to people. Nobody can afford insurance anymore, and we have the employers paying it, but most of these people are not, they're self-employed, they're entrepreneurs. We have to protect them as well.
And before I even get to the Republican health plan that ultimately failed, I want to talk about how do you think that we could fix the bigger problem? Because I'm sure you have talked to countless people. I know I have talked to people all throughout the country. Some people have said, I time strategically taking my medicine so I can cut down on getting medicine. I can buy it less frequently. Other people have avoided the doctor, going to the hospital, addressing health concerns because they're like, I can't afford that right now. How do you address the bigger problem of bringing all health care costs down?
It's a great question because what we've done historically is we target one sector. So we'll target the hospitals, right? And then outpatient costs go way up. And then we'll target the doctors and hospital costs go up. And so we're just moving the money around, right? We're not actually solving the problem. And we need to, and we need the patients to be in it as well, not by reducing the medicine they take, but by being more conscious about their diet and exercise. So, where the administration has come in on health, that's an important part of fixing the problem. Is our obesity rates are higher than the rest of the countries. We are a sicker population because of our own responsibility. But then we have to find a way where every single sector is incentivized, right? And right now, every single sector of both insurers and providers have greater incentives to increase the cost of care than to reduce it. And we have to change the incentives, and we don't even have a glimmer of a plan to do that yet.
And to that point, President Trump has said before that he thinks insurance companies are ripping people off. He wants to put money directly in the individual's pockets opposed to insurance companies. And that seems to be in lockstep with the GOP plan. The GOP plan, essentially, I'm going to boil it down here, it would let the enhanced ACA tax credits expire and instead replace them with direct payments of up to $1,500 to the HSA accounts of people enrolled in the high deductible plans. What do you make of that plan? Do you think that that's addressing the bigger problem any better?
Well, I mean, a lot of people don't have HSAs, so that's kind of a problem right there, right? And so you have to sort of be in a certain structure to even have an HSA. And the HSAs tend to be with people that have higher incomes and can sort of afford to park money. So it's even if it's $1,000, $1,500, okay, the total healthcare costs are still $15,000 a year, right? So it will maybe give you a little bit, but it's not going to solve the problem, and it's still going to cost a lot of money, and it's not going to do anything to bring down healthcare costs. It will take money again from I won't give the money to the insurance company, but I'm going to give it to the providers with my out-of-pocket costs. Those same out-of-pocket costs would have been covered by the insurance providers. We're not fixing anything. We're just moving money away, and fewer people will be eligible for that. So I don't know if that's the answer either. I don't think there are any answers on the table right now. I'm sorry to say.
I mean, I cover politics. That's the majority of my role here. And I have to say, it's so frustrating covering politics and seeing a problem that affects people on both sides of the aisle, real everyday Americans. The government was shut down for the longest in the history of shutdowns in this country, over 40 days. There was no movement on any type of solution related to healthcare costs in this country. I'm curious now what, because it doesn't seem like there's, like we said at the beginning of the conversation, we're really at an impasse here. Neither of these solutions passed the Senate. So does that mean just that the enhanced ACA subsidies essentially will expire, they'll lapse, premiums will skyrocket, and essentially that's too bad for over 20 million Americans?
Well, it's too bad for all Americans, right? Because we're all paying the price. Just because, an insurer's covering it or an employer's covering it, the employer's covering, but that goes into our prices, which goes into inflation, which we all pay for. So we're all paying $16,000 a year for healthcare, right? That's our national average, or excuse me, 15,500. It'll be 16,000 in 26. That's what we're all paying. If we don't bring this down, nothing is going to work. Everything's going to break. And so I look at the difference between what we pay and the next most expensive country. So 15,000, let's use simple math. $15,000 per person in the United States. $5,000 per person in the developed nations, right? $10,000 per person in Switzerland and Norway, the next two most expensive countries, which have much better outcomes, right? We also have about the worst outcomes. If we could just say, as a country, we're bringing down the cost of care $5,000 a person. Americans, you need to get healthier. Hospitals, you need to get people out of the hospital. Doctors, you need to stop doing defensive care and make sure that everything we do is in the best interest of the patient and the country. Then we can start to move the needle. We set a goal out, say, look, let's take care of people in the meantime, right? We can take care of people. If we reduce the cost of care $5,000 per person, that'd be $1.5 trillion a year, right? That's our deficit. We don't have a deficit anymore. We can afford to give people the care they need. So in the meantime, we have to take care of the people that are losing insurance and take care of the safety net. We have to take care of people to get us there, but we have to have a plan that gets us there. And I would say that if we lay out a plan for 5 years that says we're going to cut the cost of care, the true cost of care, by $5,000 in 5 years, and if we don't get there, we're going to have to take these types of actions, right? If the government can't control costs the way we're operating today. So this is my 5th year as a commissioner on the Medicare Payment Advisory Commission. We advise Congress on Medicare payment policy. And I would say that there is nobody in the United States that actually understands all the loopholes we have created one at a time, that people that, we put our finger in the dike over here and all the money runs out that loophole. And so we have got to have a comprehensive program that has all stakeholders involved, from patients, hospitals, doctors, insurers, and the government, and says, as a nation, we're bringing the costs down so that everyone can have insurance and no one has to go bankrupt because of the cost of healthcare.
Do you think that this is a uniquely American problem? Because when you laid out, I know we're doing simple math, simple numbers here, it costs the average American $15,000 for healthcare a year. The second most expensive countries, you said $10,000. They have better healthcare. They have better outcomes. To me, it sounds like we're getting the short end of the stick, right? I'm paying $5,000 more and my healthcare stinks compared to the other one. I mean, talk to us about that.
Right. And people in America don't know that. We think we have the greatest healthcare system in the world, and it's not even close. Right. And so we're paying wild amounts. Yeah, our prices are high, our utilization is high. We have absolutely, we are as a country have the worst healthcare system in the developed nations. And yet, we pay 3 times as much as the average across the board. And yeah, that needs to change. And we need to all be angry about this and demand this from our government and say, it's not about subsidies anymore. And we keep trying to fix it for this person and that person. It's not working. Our costs continue to rise higher than every other country every year. And that's what needs to stop.
And I think alarm bells really are going off in the country when it comes to healthcare costs, especially now that it doesn't seem like there's any plan that's going to pass through Congress, through the Senate, get signed into law. I mean, what do you think is missing from this national conversation?
What is missing is a single plan. And I know nobody wants single payer. And there's a lot of countries that control this without having single payer, right? Like Germany is a great example. But there is government oversight of the entire system, and there is a budget, right? We don't have a budget for healthcare. Every year it's like, well, whatever it costs, because we're not in charge and we don't have any controls. And so, what we do in MedPAC every year, and this drives me crazy, is we'll sit there and we'll say, well, we can't give anybody any raises, because cost of healthcare is too high. We've been doing that forever. It doesn't control the cost of healthcare one bit. If you don't give people raises, they find other ways to make more money, right? And so again, we're just, we need to this is it. This is all the money that's coming out, and we all need to figure out how to do it, but we need the incentives, right? And so right now, everyone is incentivized to just do what they're doing. And so, for example, every year, we give the hospitals and the doctors maybe 1% or 2% increases, or zero, same with the other sectors. And why is that, right? So we can keep the cost of care down. But what if we said, look, hospitals, you're 1/3 of the problem. If you solve your 1/3 of the $5,000, we will give you half of it back, right? All hospitals, everybody's in. Keep the quality at the same level we have today or better, and we start sharing those across the entire sector. So we could give them higher raises if they brought down the cost of care by, so let's say over 5 years, you want to bring down the cost of care 20% per year, right? As hospitals are now getting 1%, 2% increases every year, we could give them a lot more of that money, right? If they were part of the solution and we had an ongoing way to actually bring costs down, which has never happened in the history of healthcare in the United States that we've been recording costs, right? It goes up every year. We need to bring it down $5,000. What is a bold plan to make that happen? And how do you incentivize everyone in the ecosystem, including the patients, to make that happen?
I know that this is unprecedented because you said costs have never gone down in the history of recording them. It sounds like if you strip away any politics when it comes to lowering healthcare costs, if you get every major player in the room, hospitals, insurance, perhaps even patients, what's the likelihood of a solution actually being hammered out? Because I know that sounds great in theory, but do you think that will actually happen?
Well, it would take an act of Congress to make it happen, but at some point we're going to get desperate. We want to become, a manufacturing sector. How can we afford to be in a manufacturing sector when every employee has a burden of $15,000 a year, right? How can we do that when the rest of the world's employee burden is $5,000 a year? So we're paying for this. We're paying, a lot of our employment is services. We're all paying for this out of our pocket over and over again. And what we have to do is just find a way where we can make it a national priority and everyone puts their shoulder to the wheel. The one thing I saw that gives me hope on this was after the Affordable Care Act came out, there was a lot of talk about reducing costs. And for about 3 years, between 2010 and 2013, we almost went flat, right? Which was the first time. And then everybody we all backed away from it, right? And said, oh, we've got to do this, we've got to do that. And so people just stopped trying. Well, I saw when people really put energy into it, there was a flattening of the curve. But we've got to get the incentives right. For example, everybody benefits in the ecosystem today when prices go up, right? So everyone makes more money when healthcare costs go up, and that's what we have to change. Even the insurance companies, we've capped them at 15% profits, right? So if we achieve our goals, we could drop that cap. We don't care how much money they make if we all reduce the cost of care. But right now, if you've got a 15% cap on your profit and you're an insurance company, the only way you can make more money is for the premium to go up, right? So we're incentivizing the insurance companies to raise premium and to not bring it down. And so that's really where we are today. And, and today Medicare is like the most profitable insurance plan in the United States. Are you kidding me? Where any other sector, it's the least profitable sector, right? So what's happening here? It's the incentives. We're capitalists. We have to design a program that works within the capitalist framework and that also cares about the social good.
That's just mind-boggling, right? That the only way insurance companies can make money is to raise that premium. So obviously, as a company, it behooves them to keep raising people's premiums. What specifically in this entire conversation, because as we've talked about, no plan has passed the Senate. What specifically are you looking out for next?
So I think the Republicans have an opportunity to put a plan on the table to do something differently. All right, like I say, we had our commission meeting, and by the way, I am a MedPAC commissioner, but I want to say I do not speak for the commission. I'm just one of 16 commissioners that weigh in on Medicare payment policy for Congress. And we were just talking on Friday about, what could we do differently, and everybody's talking about nibbling around the edges. This has been where we've been stuck forever. We need a new plan, and a bold plan that says we're going to bring down the cost of care $5,000 per capita, which is $1.5 trillion a year. And that is going to be our goal. We have to move towards that goal. And if we don't get there, we might have to control all healthcare costs in this country. That's the way other nations do this, is they have price controls, they have volume controls, they negotiate all the drug prices. Right? They don't let technology come into their country that doesn't have benefit and value for the patients, right? We do, and so they won't allow it to be added to the list unless there's demonstration of benefit from either a cost, quality, access, some perspective that is meaningful to the consumer. So the government, we've all been not wanting the government to take over healthcare. I say we give the system one last chance to self-police, and if they can do it, great. And if not, then there's a cliff here. We have to take over, because we are destroying ourselves with this cost of care. Every American should not have to spend $10,000 a year more than the OECD nations for healthcare at their own expense. And believe me, just because we're not paying that premium, it's all coming out of our taxes, our prices. We are all paying the price for this. And so, yes, let's help people through this time, but let's fix it. This administration has the opportunity to make a bold and different move. And if we cannot succeed, we have to move to a more centralized system in some way, not single payer, but definitely a single governance system that doesn't allow us to play whack-a-mole with the money and doesn't have all the incentives, which 100% of our incentives are in the wrong direction for every single sector of healthcare, including the patients.
Lynn, it's a really important conversation that I don't think is going anywhere. It impacts every American. And as we see, hopefully, positive developments come out of this, I hope you can come back on and break it down for us. You are welcome back anytime. Thank you for joining me.
Thank you so much. And good luck, America.